Welcome to Friday's edition of COVID-19. There has been a rather alarming surge in cases today, with authorities here recording almost 500 new infections. Now, this comes amid ongoing research on the effects of vaccines on children and pregnant women. We have details after the pandemic updates with our Kwon So-ah. Now, so to start with the latest numbers here in Korea.
Sunny, just 6 cases short of 500 this Friday, with 494 infections reported as of 12 a.m. And that's the highest number for a daily tally in more than a month. So in total, Korea's accumulated figure now stands at 100,770 and the death toll at 1,716. Officials say for 10 weeks now, the numbers have been lingering in the 300 to 400 range. And in the past week, as our graph shows, there was just one day when we dropped to the 300s, and 400s have been dominating the daily caseloads. So that's raised the average of domestic transmissions in the past week to 414. So inevitably, the government decided to extend social distancing measures for another 2 weeks, as they were officially to come to an end this Sunday. Also, the ban on private gatherings of 5 or more people remains in effect, and authorities have also vowed to strengthen antivirus management at public use facilities. This is why.
According to our analysis of cluster infections from last June to mid-March of this year, 23% of symptomatic cases were linked to public use facilities such as bathhouses and cram schools. This implies that restricting people with symptoms from going to public use facilities could have prevented 20% of those cluster infections.
And many infections linked to such public facilities have occurred this Friday, too. We have almost 200 cases in Gyeonggi-do province, more than 120 in the capital, Seoul, and almost 30 in Incheon. Also here, still quite a high number in Gyeongsangnam-do province with 37 new infections.
Right. Meanwhile, so on the local vaccination front, I understand high-ranking officials received their first shot this Friday.
That's correct, Sunny. Following the president himself earlier this week, this Friday, Prime Minister Chung Se-kyun and Health Minister Kwon Deok-chol have been administered with AstraZeneca shots earlier this afternoon. And the officials are seeking to reassure the public on the safety of the vaccine and also encourage the participation of everyone in the inoculation program. And it's been now a month since Korea's vaccination program has kicked off. And so far, we've got over 767,000 vaccinations completed when it comes to the first dose, and also more than 3,800 who have received their second shot.
Right. Elsewhere around the world, I understand alarming records have been reported in Latin America.
Right, Sunny, and especially in South America. In Brazil, over 100,000 daily infections were recorded. That is a record high for a daily figure, according to the health ministry there. And also, Mexico has become the third country around the world to have more than 200,000 fatalities in total. Let's take a closer look at the numbers now. Here, the U.S. and Brazil have the highest numbers of fatalities, but also they are the countries with the highest number of infections, while Mexico, with the third highest number of deaths, has the 13th highest number of infections, which means that's quite a high death toll per population, that is. And if we take a closer look at the figures here, we also have surges in Peru, which has just hit 1.5 million infections. And in Poland, meanwhile, over 34,000 cases were reported in the span of 24 hours. And with that, the world has a total of 126 million infections. And those are the updates I have for now. I'll see you back on Monday. So back to you, Sunny.
All right, so thank you for that. Now, staying with COVID-19 related news on the international front, U.S. authorities are hoping public vaccinations will serve to stem the spread of the pandemic, which continues to raise daily numbers there. I have Kim Sung-yeon here in the studio with details on that. Welcome, Sung-yeon.
Hello, good afternoon.
Right, then let's begin in the U.S.
Right, the United States, as you know, recently crossed 30 million coronavirus cases. And this is as states have been accelerating the vaccination process by lowering the required age limits. Now, although cases are trending higher in 30 out of 50 states compared to the previous week. Health officials are hoping that the vaccinations will prevent a rise in the death toll. Now, health authorities are racing to distribute more vaccines following the first on-week rise in new cases since January. Nearly 1/4 of all Americans have received at least one dose so far, and around 13% of the entire U.S. population have been fully vaccinated. The White House is expressing cautious optimism that the vaccines are working as intended so far in protecting the health of the American people. Let's take a listen.
It was very clear in your presentation and your slides, which I hope is coming clear to the American public, which is that these vaccines are being proven to work.
However, against the advice of health experts, several states have lifted mask mandates at a time when more infectious new variants are spreading across the nation. In New York City, public sector workers will return to their offices in the beginning of May. Even though the city's mayor said strict safety measures will be in place for returning workers, experts are worried about a rebound in cases, especially with more people traveling for spring break. Regarding the current situation, the top U.S. infectious disease expert said he is not ready to say the nation has turned a corner in the outbreak. Take a listen.
I don't think you can declare victory and say you've turned the corner. You've got to continue to do what we're doing, more vaccinations, and continue to do public health measures until we actually do turn the corner.
Therefore, public health experts in the U.S. are taking every opportunity to warn that relaxing social distancing and other preventive measures could easily lead to another surge. Regardless, experts have noted that with vaccinations proceeding quickly, unmistakable signs of progress indeed have been made across the United States.
Right, and that is good news, of course. Now, speaking of vaccines, AstraZeneca Song-yeon has disclosed fresh data on the efficacy of its vaccine following latest clinical trials in the U.S., right?
That's correct, Sunny. And the company is now working to secure FDA approval. AstraZeneca, like you said, its COVID-19 vaccine is 76% effective, according to its latest trial results, slightly lower than what the company reported earlier this week, which was criticized for using outdated data. Interim analysis published on Monday estimated the vaccine's efficacy rate at 79%, but had not included more recent infections, leading to a highly unusual public rebuke from U.S. health officials. Now, in its latest analysis, AstraZeneca also said that its vaccine, developed in conjunction with Oxford University, was 100% effective in preventing severe or critical illnesses. Now, 8 severe cases were reported in the trials, all among participants who received a placebo. One infectious disease expert noted that the vaccine's protection against severe diseases and deaths puts the AstraZeneca vaccine in the same ballpark as the other vaccines, adding that he expects the shot to gain FDA approval sometime soon.
Meanwhile, over in India, I hear we have an unsettling development there amid the emergence of a new coronavirus variant.
Right. The number of daily infections and deaths over there in India actually are now at their highest level of the year so far. As you mentioned, India also reported a new variant of the coronavirus on Wednesday, and the variant, described by officials as a double mutant, has been found in more than 200 samples in the hardest hit western state of Maharashtra, which is home to India's financial capital of Mumbai. Now, epidemiologists said the term double mutant refers to an entirely new variant that has the characteristics of 2 already identified variants. And in this case, a new variant called E484Q and another variant called L452R, they were found together in the earlier mentioned samples. Now, noted public health experts said, however, that double mutant is not a scientific term, but rather just a new variant that is unique to India. Now, he added that we should temper our concerns for now because there is no evidence to suggest that this new variant is more transmissible or more lethal. Nevertheless, India's director of the National Center for Disease Control indicated that the variant is evolving, adding that 9 such samples were also found in New Delhi, which has seen a steady rise in infections over the last few weeks. Now, Indian health authorities did say that they will continue to investigate the double mutant, its infectivity, as well as the implications on COVID-19 vaccines.
All right then, Song-yeon, as always, thank you for that coverage.
The pleasure is mine.
Right, elsewhere, medical experts are not simply fighting COVID-19, they're also tackling all the other ailments that have plagued people prior to the pandemic. For more on this reality, I have Dr. Kim Byung-chul, who is currently in Nepal, live on the line. Welcome, Dr. Kim.
Yeah, nice to meet you.
Right, Dr. Kim, let's start with the COVID-19 situation in Nepal. How are authorities there containing the pandemic?
Nepal government has tried to control COVID-19 situation. Nepal has 270,000 confirmed cases until now. The most serious period was last October. At that time, every day 5,000 cases occurred. From January of this year, it has stabilized. About 100 cases just occurred, but recently it is going to be slightly elevated, about 200 cases. In my opinion, it is affected by situation of India. India is and Nepal is a neighboring country. India has many patients. It looks like Nepal followed the situation of India.
Now, Dr. Kim, I understand the hospital you're working at was designated as the official medical center to treat COVID-19 after its outbreak in Nepal. Do tell us more about this.
Yeah, I would like to. This hospital, this Korean Nepal Friendship Hospital, was founded in 2008, supported by KOICA, Korea ODA agency, with $1 billion. It was built just a 30-bed size small hospital, but it's growing up. 2019, 180,000 patients visited this hospital. In this COVID-19 situation, this hospital was the second hospital which equipped PCR test lab. And until now, 18,000 PCR cases were performed, and 200 COVID-19 patients with 2 Korean COVID-19 patients was admitted and to treatment.
Right, Dr. Kim, as you mentioned, you've also handled surgical procedures for COVID-19 patients. Now, I would assume that even the most common medical procedure has been rendered challenging amid the pandemic. What are your thoughts on this?
Yeah, it was very difficult job for operation with COVID-19 patient. I had one experience, appendectomy case. It was the emergency case. That time, my team was very worried about COVID-19, and so we wear operation shirt and operation gown, and also personal protective equipment also, and goggles and 2 gloves and shoes. Yeah, we wear too much garment, so that was very hard, but the operation was well done, and the patient was clearly well.
I see, that's good to know, Dr. Kim. Now, you've also been seeking to share your expertise with novice doctors there. Please do elaborate for us.
Yeah, as a doctor, I'm a surgeon of general surgery. Yeah, I have my practice is abdominal surgery and also all kinds of skin surgery. And also, I'm a specialist of anal surgery and colonoscopy. Yeah, but there's few specialists of anal surgery and colonoscopy. So I have taught about anal surgery and colonoscopy to young doctors.
I see. Dr. Kim, what has been the most rewarding about your work in Nepal?
Actually, most of our working time is worthwhile for me because it is outside of working from my hometown country, South Korea. But I remembered one patient. That patient had big problem as narrowing anus. His anus size is just smaller than pencil size. So he tried to took operation and visited other hospital in Nepal, but there's no specialist of this kind of surgery. So I got operation is anoplasty. Anoplasty is a widening operation using skin flap, and he was really happy about his condition. He could pass through without any kind of medicine. So that time is most rewarding and awesome experience.
I see. All right, Dr. Kim, thank you very much for your time and for your thoughts, as well as your efforts aimed at improving global healthcare.
Thank you very much.
Right, now back here on the local front, come April 1st, senior Koreans aged 75 and above will receive their first dose of the COVID-19 vaccine, kicking off the broader public inoculation campaign of the second quarter. I have Chun Song-cho up next. Hello, Song-cho.
Good afternoon, Sunny.
Now, Songcho, I hear you're sharing with us scenes from Seoul's first public vaccination center.
Yes, I'm at Seoul City's first vaccination center set up inside the Seongdong-gu district office. So this is where the vaccines will be administered into people's arms starting next Wednesday. That's April 1st. So that's when the country's second phase of vaccination immunization drive will begin. So what's special about this center is that this center is operated by Seoul National University Hospital. That means all the medical workers here will be Seoul National University Hospital staff, and they'll be in charge of managing the entire process from vaccination to emergency response. And this center is actually the country's first center to have adopted such a specialized operating model run by a tertiary hospital. So let's run through what the process is like for you to get that vaccine in your arm. So first of all, if you're eligible for the vaccine, if you're Seoul resident, age 75 or older, then you'll be asked to schedule an appointment on the KDCA website. And then you'll fill out a questionnaire, answering questions concerning your health conditions. And then upon arrival at the facility, just print out a ticket from the kiosk without coming into contact with anybody. And then you'll be allowed to enter the facility. First, you walk through this air purifying machine, or the gate. This will dust off all the fine particulate matter from your bodies and clothes. And then you enter this, what used to be the auditorium of the district office. Here, as you can see, there are 4 examination booths, and beyond that's 16 vaccination booths. So here, health workers will ask you questions to see if you're healthy enough to get the vaccine. And then if you are, you will be moved to this vaccination booth. Here, you'll roll up your sleeve and get that injection in your arm. And looking at the center capacity, we're expecting around 600 people to be inoculated on a daily basis at the center. But this is not all. This is not the end. You don't get to go home right away. You'll be asked to move to a different room, what used to be a library at the center. So this is the monitoring room. You'll once again walk through air purifying gate. And as you can see, there are about 100 chairs set up inside the library. And here people will have to wait for about 30 minutes sitting in the chair, and to see if you have any immediate reactions post-vaccination, like allergic reactions. So if you're sitting here, then you'll be socially distanced from others as well. If you do feel uncomfortable, then you get to press the button on the side, and this will immediately notify healthcare workers, and then they will provide any emergency first aid if necessary, and even move you to a bigger medical facility. So now let's talk to one of the officials here at the center. Good afternoon.
Good afternoon.
All right, so what kind of preparations are underway ahead of the opening of the center next week?
Our Seoul National University Hospital will provide medical staff support, vaccination, including immediate response to adverse reactions. Monitoring room with 100 seats are prepared to check body conditions after the vaccination. And we also made a program that allows you to fill in the preliminary form beforehand. For safety and convenience, we established a standard operating system and recruited talented medical staffs.
All right. And do you have any words for our viewers out there, for those who may be eligible for the vaccine and awaiting for the first dose of the vaccine?
Well, vaccination can prevent corona infection by building immunity against the virus. And when a certain level of population is vaccinated, we can achieve collective immunity, and thus we'll be able to take off our masks. For those concerned about vaccination, there's nothing to worry about because we will follow safety rules and systematically monitor adverse reactions. After vaccination, muscle pain, fever, headache, and chills are common, and most of these symptoms improve within 3 days. In this case, painkillers such as acetaminophen may be helpful. But if it gets worse, please be sure to visit a hospital nearby.
All right. Thank you so much for your time this afternoon. Thank you.
Thank you so much.
All right, and now the Seoul Metropolitan Government plans to establish additional 29 vaccination centers in Seoul City alone. So their commitment to vaccinate as many people as quickly as possible is just amazing. But let's remember, it'll still take some time to reach that herd immunity in the country. So in the meantime, let's do our part, strictly abide by social distancing guidelines. This has been Jeon Sung-cho from Songdong-gu, and back to Sunny in the studio.
All right, Song-cho, as always, thank you very much for that coverage.
현재 임신부와 소아청소년에 대해서는 백신 접종 후에 안전성 및 유효성에 대한 임상 연구 결과가 나오기 전까지는 백신 접종을 권장하고 있지 않습니다.
While COVID-19 vaccines are available, research thus far has been limited with regard to two groups. This will include children and pregnant women. Now, for more on this reality, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome, Dr. Kim.
Good afternoon.
And virtually, I also have Professor Lee Hyun-ju at Seoul National University, who is also at the university's Bundang Hospital. Pleasure to have you with us, Professor Lee.
Hello, I'm happy to be here.
And again with us virtually is Professor Dana Wolf at Hadassah University Medical Center in Israel. Pleasure to have you, Dr. Wolf.
Glad to be here with you from Jerusalem, Israel.
Thank you for that. Now, Dr. Kim, let's begin here in the studio then. What are the reasons behind the exclusion of children and pregnant women from Korea's vaccination campaign?
Well, first of all, there is no clinical trials for the pregnant women and then the children at the moment. And then I think because the reason is that the clinical trials in those groups, it's not really easy compared to others because their immune responses are different. For example, like some children, well, experts say they maybe at the age of 6, maybe just their immunity level is very similar to the adult level, but then their immunity is still just maturing and then some unpredictable. So, and also in the case of some women, also their immune response is quite different. For example, like well, when the women has some pregnant, they have their baby fetus in their womb. But this the women should not recognize the fetus as a foreign object. If they recognize this as a foreign object, their immune response can just attack them. So that generally just immune response in the pregnant woman is pretty low status. And so that's probably why. And also in the case of children's, in the beginning, actually, based on all the clinical data, actually the chances of getting very severe disease is pretty low. So there might be some hesitancy in terms of parents, whether the children go into for some clinical trials or not. Even without some clinical trial, they can say, well, maybe our children may be safe without just vaccination. So they may just partially explain such kind of lack of just a clinical trial so far.
Right, and keeping in mind what Dr. Kim has just said, Professor Lee, what are some important factors to consider with regard to COVID-19 vaccines and children?
Yes, before we vaccinate younger children, we will have to be able to define the proper dosage, assess the immune response, and check the safety profile among children. Fortunately, clinical trials are being done in younger ages, and once these factors are established, hopefully we will be able to have a vaccine for children in various age groups.
Right. Now, Dr. Kim, as we speak, just as Professor Lee has mentioned, Pfizer and Moderna are conducting clinical trials on minors. What can you tell us about these trials?
Well, I think their trial actually started as early as, I think, December, when they actually finished their phase 3 clinical trial for adults. And then the first trial was, well, their actually trial is like some sort of just age de-escalation, which is very common to a drug development company. So they actually start with the adults, because in the case for the adults, it's more just, especially some elderly group are more susceptible to the disease. So when they just finish such a clinical trial, then they move to the younger generation. And then in the case of the Pfizer, while the current approval is about just the people above or just the 16 years of age. And then now they are trying to the age group between just 12 to 15. And for like Moderna and then others, they are trying the clinical trials between 12 to 17. So once they just finish, they will just move on to this as a younger generation. Sometimes like a little just a staggering manner. So then based on some results of clinical trial, then they can just assure, then let's move on to the next the age group and so on. So I think that's the thing they will just try for the upcoming just clinical trials for the children.
Right. Meanwhile, Professor Wolf, I believe Israel, for its part, has already vaccinated some 600 children between the ages of 12 and 16 with the Pfizer vaccine. Could you tell us more about this strategy?
Yes, that's true. Indeed, 600 children between the ages of 12 and 16 were vaccinated by the Pfizer vaccine. I should stress that authorization was received for each of them to receive the vaccine on an individual basis by a special committee of the Ministry of Health, due to the fact that they or their very close household member had risk factors which put them at significant risk for severe COVID-19, including obesity, including immunosuppression, or type 2 diabetes mellitus. So weighing the risks in these children versus the potential benefit or the potential risk from the vaccine, which was estimated to be very low at this point, we decided to approve vaccine for these specific cases. And I can also say that so far, none of these children had any significant side effects from the vaccine.
I see, that is good to know. Meanwhile, Professor Lee, there is belief that post-inoculation adverse reactions could be more severe within children as they have more active immune mechanisms compared to their older counterparts. What are your thoughts on this, Professor Lee?
Yes, children have a very robust immune system, and the response to vaccines may differ from adults. Children may have stronger adverse reactions, and these reactions may last longer. However, the data we have currently show that the vaccines authorized generally are generally safe for the ages included in the authorization. And we have a lot of experience with vaccinating children. Therefore, the general consensus is optimistic for the safety profile in children, but at the same time, we will have to take a good eye on the short-term and long-term safety profile in children.
And keeping that in mind, Professor Lee, what precautions are necessary during clinical trials, including the young?
Yes, children are in the developing phase of immunity, and the immune status differs at different ages. Therefore, the immune response to the COVID vaccine may be fairly different from the adult. Though the composition of the vaccines may not change, the dosage might. Teens are likely able to get the same dosage as those in adults. However, younger children may end up with a lower dose. Though through clinical trials, we will have to find the lowest possible dose that is both safe and efficacious and produces a significant immune response in children.
Right. Professor Wolf, let's now shift our focus, that is, to pregnant women. I believe you're currently involved in a related research on that. Do start by telling us a bit about the importance of COVID-19 vaccines for expecting mothers.
I didn't hear your question, the last part of your question. Could you repeat, please?
I was asking about the importance of COVID-19 vaccines, Professor Wolf, on expecting mothers, on pregnant women.
Okay, so whereas it wasn't clearly realized at the beginning of the pandemic, it is now increasingly recognized that pregnant women are at increased risk for severe COVID-19, associated with hospitalization, intensive care unit admission, and even death. So, for example, out of approximately 10,000 pregnant women with COVID-19 in Israel, 100 had severe COVID-19 and 3 unfortunately died. So in addition to the risk in the pregnant women themselves, COVID-19 is associated with untoward obstetrical implications such as preterm birth and also occlusion of the blood vessels that feed the placenta and the fetus. That can lead to intrauterine death, intrauterine fetal death, and we have seen these cases in Israel recently before the vaccine. So weighing carefully the risks in pregnant women and the potential benefits of the vaccine, we have decided in Israel to recommend the mRNA vaccine for pregnant women in their 2nd and 3rd trimester to protect the women from severe COVID-19, and as I will talk later, also the neonates.
Right. Now, as Professor Wolf has mentioned, Dr. Kim, COVID-19 vaccines, the Pfizer one, it is allowed for pregnant women in Israel. Here in Korea, COVID-19 vaccines are not allowed for pregnant women. And over in the US, the decision is left entirely up to the individual. What can you tell us about the differing stances with regard to COVID-19 vaccines and pregnant women?
Well, I think regarding all the different responses, I mean, the reactions of all different countries about the vaccination of the pregnant women, I think the main reason is just a lack of data in the pregnant woman. And I think, but at least January in this year, January, the WHO actually recommended the vaccination, specifically with the mRNA-based vaccine, particularly with the Pfizer and the Moderna, and then especially just recognized for vaccination for some high risk the groups, potentially like working in some frontline, also in some underlying diseases, and then also after the consultation with the physicians. But I think still just there's some lack of data, and then that's what actually acknowledged by the WHO, and then they say they do not actually recommend any broad, vaccination at the moment. But this is probably just wait for some individual consultation with the physician, and also like the underlying whether the certain people is on the risk groups or not. But at least, fortunately, just last month, the Pfizer announced that their clinical trials on the pregnant women. So we will see.
Right, we will see. Meanwhile, in that time, though, Professor Wolf, your research has found that vaccinated pregnant women pass COVID-19 antibodies to their newborns. Could you tell us more about this, Professor Wolf?
Yes. To date, I can tell you that more than 50% of pregnant women in Israel have been vaccinated so far with no adverse effects. And as was clearly mentioned in this panel, due to the fact that pregnant women were excluded from the vaccine trial, there have been limited data regarding the efficacy, or in other terms, the ability of these novel vaccines to drive sufficient immune response in pregnant women. So in a pioneering study at the Hadassah University Hospital Center, which is a major tertiary care center in Israel, we assessed the immune response, the antibody levels, in pregnant women who presented for labor at our hospital, pregnant women who had been vaccinated with the COVID vaccine in their 3rd trimester. And we concurrently, at the same time, we also assessed the antibody levels against the virus in the cord blood, representing the antibody level in the neonate. So what we found, and this was very encouraging, that pregnant women mounted a robust antibody response to the virus. We found an adequate and protective antibody levels in all pregnant women. To date, more than 70 women that were included in our study. And we also found very high antibody levels, adequate antibody levels in the neonate, in the cord blood. So we could clearly see that pregnant women were able to pass their immunity or their antibodies to their children. And it should be realized that the protection from infections in newborns is mainly confirmed in the first period of life by the antibodies that are passively transferred from the mother to the fetus or to the newborn during the pregnancy.
Professor Wolf, what do you suppose are the implications of your research?
So what we found, and I think this is very encouraging, that maternal immunization has a win-win, double win situation. It protects both the mother from severe COVID-19, and I should say that none of the mothers which were admitted with severe COVID-19 to our hospital was immunized. And also at the same time, these antibodies, the vaccine, maternal immunization protects the newborn. And I think these studies, beyond being encouraging, can guide strategies of immunization and can guide further studies, which are in fact conducted now by us, as well as probably by others, to examine the optimal timing of vaccination, of maternal immunization during pregnancy, the longevity, durability of these antibodies, how protective they really are for the baby and for how long, and how well they integrate and augment later with breastfeeding.
Meanwhile, Dr. Kim, what are the precautions that need to be followed during clinical trials involving pregnant women then?
Well, actually, I think the clinical trials, the immune response, as I told you, immune response of pregnant women is actually different compared to other non-pregnant women, probably at the same age. One of the reasons is I told you that the immune response is generally very low. And also their lung capacity is not really just sort of just normal, because their lung capacity and then oxygen just change is somehow just now divided by between just the mother and the fetal. So basically just the lung capacity is pretty low. So we need to just keep an eye on it. I mean, just very carefully just monitor all the clinical trials. And there seems to be some ethical issues regarding whether who should get some vaccine and who should get the placebo. So that's the one thing that may have to be considered. And also, while just these clinical trials, I think some primary endpoint might be just different. Just prior the clinical, just phase 3 clinical trials, the clinical trial was conducted about just tens of thousands of people, and the primary endpoint was just whether they have some COVID-19 disease. And then so actually determine whether they have the symptoms or disease. But in this case, maybe such kind of thing may not be just available. So instead, they might be just using some different surrogate markers. So instead of just detecting any disease, they might just check some sort of just markers, for example, like neutralization antibodies. So then actually there need to be some kind of a global, international consensus, which level of neutralizing antibody is protective enough. So that has to be somehow, the consensus has to be attained among the some global levels. So that things is one of the things, I think. But once we just adapt this sort of just immunological correlative protection, they may be just extended to just the clinical trials for these pregnant women, also for clinical trials for the children. We have actually some prior examples of such kind of case. For example, like rabies vaccines, and also some the human papilloma vaccines. The people actually use such kind of some surrogate markers, because we cannot actually wait for the occurrence of, for example, like rabies. This is very dangerous, just a disease. So that can be done for these clinical trials for women, just pregnant women, and also for children as well.
I see. Meanwhile, Professor Lee, what are your thoughts with regard to the timing of COVID-19 vaccination for minors?
Yes. Trials are underway with adolescents currently, and we expect to have the data late in the spring or early summer. If these vaccines are shown to be safe and effective, kids over 12 years of age may be able to get the vaccine as early as in the autumn. Trials with children over 6 years of age have been enrolling since February, and just this month companies have been starting enrolling children as early as 6 months of age. So if these trials go well, and hopefully we will be able to have a nice vaccine for children in younger age groups at the end of this year, or maybe early next year.
Right, we'll keep our fingers crossed for that. And Dr. Kim, what are your prospects with regard to COVID-19 vaccinations for pregnant women then?
Well, I think at least, as I just told you, the WHO actually recommended some vaccination for the women with some high-risk groups. So at least there is a way that there way for just vaccination for the people. But if you just consider some clinical trials, Well, it's hard to tell. I mean, whether how many women, how many pregnant women will just volunteer for such a clinical trials, I'm not quite sure, and it's pretty just unpredictable at the moment.
Right. Professor Wolf, Israel is the global frontrunner with regard to vaccinations of the public. What are your thoughts on the impact of vaccination on Israel's COVID-19 numbers thus far?
Oh, there is a dramatic fall recently due to the vaccination. After the vaccination, I think the vaccination was very well orchestrated and organized due to a relatively strong public health system in Israel. And I think we are seeing now the consequences of this massive vaccination campaign that started in December. The numbers are falling, and hopefully, we are learning from day to day, but it looks very optimistic. We are gradually releasing now, not completely, but with a lot of caution. We are gradually releasing the social distancing. We are in a major holiday now, so families are able to get together tomorrow for the Passover holiday. And I would like to say that I think that the clinical trials in pregnant women are important, but I think the world can learn a lot now from the experience that we have gathered in Israel to drive strategies, vaccination strategies.
Right. All right, Professor Wolf, thank you very much for your thoughts. Professor Lee, thank you for your thoughts as well. And Dr. Kim here in the studio, thank you for your insights. Right, now mindful of the prevalence of COVID-19 on the local front, authorities here have decided to extend social distancing guidelines for 2 more weeks. That will be until the 11th of April. Thank you for watching and have a safe weekend.
We use plastic bags on a daily basis. But once discarded, they take centuries to degrade. They are convenient to use but harmful to the environment. A technology has been developed to transform plastic bags into industrial oils such as gasoline and kerosene. Korean researchers have developed a technology for harnessing high-quality oil from waste plastic bags in a cost-effective way. When discarded plastics are heated at 400 to 500 degrees Celsius, they undergo thermal degradation.